So this workshop's not going to be crazy long, but also going to do my best to make sure it's not just dry, boring either. Right? I'm going to try and make it as relatable as possible to you guys, and get not too technical, but enough to help you understand how your body works and why this is relevant, especially now since so many more people are working from home than before. And why are we working longer hours at home rather than being at work? Blows my mind. I guess I guess our bosses and people who manage their time believe that they're always saying, "Oh, just one more thing, one more thing. Oh, can you do this one more thing?" without barriers or time. So it's a problem, it's a challenge, but we'll get through this together. Okay, folks, I'm ready. Are you ready? Ready? Yep, you are. I hear you. So, good afternoon, Friday, 4 p.m. This is Dr. Max, teaming with Dr. Tim, delivering our last workshop of this body signal series over this break, because this will be my last body signals workshop with this team, with this company, before I return to the United States in 2 weeks. It is bittersweet. But let's go out with a bang. Let's make sure that you guys get as educated and informed as much as possible and create this tradition, monthly tradition. Anyhow, so all about. Okay. All right, so just gonna get started here. Sorry, a little bit of a snag. All right, open, good. All right, folks. Let me just recalibrate my screen for a second. Okay, start now. We'll start. Okay, so this is all about how to end neck pain. Pretty straightforward. What I'm going to do is that use a lot of the slides right now to illustrate what we're going to be talking about. However, if as anything that's really important, I'm going to pull away from the slide and talk about this in person with you guys. Okay, so the most important points I need to illustrate without the slides. We'll pull away, cut away, and just so that it makes some clarity. So it's all about end neck pain. Guess what? Longer hours working from home, at the desk, at the computer, at our kitchen tables, whatever it is. And this is a common posture. Now, here is the culprit. The culprit is this: our text position, right? How often are we in this position? Forward, head looking down at a screen, such as our cell phones, or are we gaming? We do that a lot. I see that in Singapore. In fact, tonight when you go to the store or you're on the MRT, on the train, look around you, pay attention to how many people are in this position. Heck, you may even have any family members right now that you know that are watching something online on their tablet or computer that looks like this. This is a big problem because it creates the issues, at least the issues that we're going to be talking about today. The issues such as chronic neck pain. That doesn't go away. You wake up with it, you try to exercise, and it comes back again and again and again. May feel good at the beginning, middle of the day, and then comes back in the morning. All right, it doesn't really go away despite how much massage you have. Or nerve problems. Sometimes you feel like funny in your hands, the fingertips. Wake up in the morning, it feels cold. Temperature changes as well. Those are nerve problems as well, or sometimes a difference in strength. And it can lead to the text neck from holding your phone too often, too much like this. Ultimately leads to herniated or bulging disc. Herniated or bulging discs. When it gets to that point, or as it progresses to that point before it becomes a herniation or bulging discs, it creates a whole bunch of warning signs, signals that you experience that indicate that you are suffering from tech neck. So these are some of the signals you might recognize. So neck pain, obviously, stiffness, tightness, A lot of people refuse to say, "Oh, I have pain, doc. I have pain here." It's such a taboo word. But if it's not pain, if it's a restriction in how you feel that you move, okay, that's usually an indication of the problem of developing the disc issues evolving. Loss in range of motion, meaning that. Let me just show you what range of motion should be. So here's an example of what it should be. Normal range of motion. And from this view, you should be able to tilt it with your shoulders level. You should be able to tilt your ear 45-degree angle all the way down. Okay, 45 degrees either side. Okay, for me, it bends easier one way than the other way. In fact, I do have some ongoing degeneration from years, but 45 degrees is a frame of reference that we look for to see, do you have any loss in range of motion and how you bend? Now, in this view, you should be able to bring your chin to your chest, and it should only feel like a stretch back here. In this view, you should also be able to only extend the neck back, and your face should be able to get horizontal with the ceiling, flat with the ceiling, without your body swaying forward to try and compensate. So that's another test of a range of motion. And when you're turning from side to side, you check to make sure that when you turn your head, it should almost be able to touch your collarbone, in line with the collarbone, side to side, right? So from the side to the collarbone. So that's a range of motion that you should have. If you're doing this right now and you notice that you don't have that range, that's a problem. Loss of range of motion. It has some ongoing cervical problems that will lead to eventually or reflect degeneration. And degeneration can also include arthritis too. Arthritis. That's really something we can't see through your skin, but we can feel the effects of arthritis, and we can confirm that when you look at diagnostic imaging such as MRIs or X-rays. And the X-rays are the ones that we often look at the most. Popping and cracking. If you're a person who always feels a need to do this to your neck just to get relief, to do this, I just need, doc, I just need like a quick, don't do that yourself. Do not self-adjust. All right. Too many blood vessels around the back of your neck that goes to the back of your head that supply blood to your brain, to the occipital region. And if you try and do it yourself, you put yourself at a risk of arterial dissection. So please do not try and self-adjust, self-crack. It's not a good habit to do. Now, when you have neck issues, neck problems, these body signals, other signals may involve also to refer down the shoulders or arms, sometimes weakness, sometimes imbalances. It may show up in your posture, but sometimes it shows up in not being able to lift weights or run a certain way, or we have an imbalance of one side versus the other, tightness. So it leads to arm issues, either arms, elbows, sometimes the wrists, sometimes the hands. When people can complain of carpal tunnels, and I know people go for carpal tunnel surgery, and they get their surgery for this, right? They get their muscle cut so that releases the tunnel of the carpal ligament so they don't feel inflammation. But if they still have the same problem, then we got to figure out, hey, it's not a surgical issue. It might be tracing all the way back to the neck, the root of that nerve that serves down your arm. And if you have it on both sides, that's definitely more of a root issue than an overuse issue. And then last but not least, headaches, migraines, the most common sign, a very common sign of, or body signal of neck problems that manifest as, that result from degeneration and could indicate an ongoing problem that can lead up to herniation discs. Okay. All right. Everybody with me so far? Good. So all these signals, right? These aren't, we're not going to treat the problem. I'm not concerned about the pain. I care about your pain. We care about your pain, but we're not only just masking the pain. Okay. Masking the pain that you feel, addressing where you're pointing to us. Hey, doc, my pain is right here. It's like us taking care of the top of the iceberg and neglecting what's happening beneath the bottom of the iceberg. So your body is trying to say, hey, something's not right. These are signals that your body's trying to talk to you with, but you may not recognize how to understand how to read those signals. We are trained to help ask the right question as to why those signals are happening in the first place. So you pay attention. Are you listening to your signals, or are you ignoring them? So just because you're pain-free does not mean that you're well. In fact, if you look at the wellness spectrum, this little chart that you see right here, being pain-free might mean that you're just at that neutral point, right in the center. Right in the center. Doesn't mean that you're fully that you're fully healing, repairing, or optimizing. Um, Even you can be even to the left of that screen, to the left of that chart, where you might have a few more signs without any necessarily pain. But to keep moving in the positive direction to the right requires education, requires a lifestyle change. By only responding to your health and only paying attention to how you take care of your health when you feel symptoms, means that you're hanging out on the left, that you're leading towards the path that goes towards premature disease, premature death. And we want to, using this workshop, along with other body signal workshops, lead you towards the direction towards the right. Okay, now, say all that to explain this. This is, we're going to use the spine. This, we're going to use a big illustration. So, everybody's got one of these. Now, your spinal cord and all those nerve messages, it's kind of a two-way street, and it carries two sets of nerves. One set of nerves that you can control is for the body movements, how you turn your head, how you stand, how you sit, how you run, how you work out, but also the unconscious control of other things such as your posture you don't really think about. That's called the motor control. Half of, probably 40% of your nerves control that function of your body, what you can consciously do and feel. The other 40% controls other organs of your body, the things that you don't think about. So when you're stressed and you actually have bad news, or let's say you're late for an exam, or late for a test, or you're late for your wedding, oops, regardless of whatever reason, if you're late, then you start to notice other symptoms that arise, which is like your heart rate goes up, you sweat, hair stands on your end, your liver actually starts to produce certain enzymes, your pancreas starts to kick into gear, your digestion system stops. So all these different systems are part of your fight or flight response. We call this the autonomic response. Sounds like automatic, autonomic. So these are the responses that your organs go through and regulating to keep you alive and also respond to stress. Okay, so you got 40% of your nerves control how you move. The other 40% controls how you feel, how your body functions, your organs function. And the last 10% of those nerves control what you feel. Got that? So the last 10% of that bundle of nerves in that spinal cord, so looking down the tube, if this is your spinal cord, 1/10 of that carries pain signals. So when you're getting adjusted or actually getting your spine aligned by us, we're not only concerned about that 10%. We're concerned about the other 90% of that nerve of your spinal cord that's protected by your spine. And that the reason why if your spine is misaligned, it could damage that 10% or it could damage 90%. You don't want us focusing only on that 10%. You want us focusing on the whole nerve. And that's the reason why we're not just paying attention to your pain. Got that? Good. All right, let's keep going. So let's start off with a fresh slate about how you understand your health. So this is the premise that we strive for everybody to try to understand, that healthy is normal. It's not abnormal to be healthy, right? I guess people here are accustomed to complaining about the aches and pains, but guess what? You're designed to be healthy, and your body is intelligent. Your body is smart. Okay, when you have bad food, bad sushi, and you throw up, you don't have to think about it. Automatically, it's pre-wired to expel whatever toxic ingredient that you've taken in to protect itself, right? It's automatic. Okay, your nervous system is the master control system of the body. Every single cell, tissue, and organ cannot exist, cannot function without nervous system input, without a direct link connection to the nervous system. So you cut off the nervous system, you simply die. Okay, you cut off smaller nerves in your nervous system, anything connected to that smaller nerve will shut down, will cease to function properly, or will function at all. So your nervous system, this is the take home point. Your nervous system is the master system. So the question is your spine that functions like a suit of armor around your nervous system, is it functioning to protect it or damaging it without you knowing about it? Is it in a protective position or is it a damaging position? All right. And the last but not least, guess what happens nowadays? Our life is stressed. Modern life is stressful, more so than generations before. They had different types of stresses. Okay. They had the stress of survival. Am I going to eat? Am I going to feed my family? Can I sustain myself from the elements? Do I have a place to live? Those are the typical stresses from the past. Now we have way too many more stresses, because we have stresses such as, hey, where are we going to go on vacation? Are my kids going to get into school? Are they going to pass the PSLE? Are they going to get into O levels? What am I on my older parents? So we have these lifestyle stresses that actually are part of creating this dysfunction in our health. Okay. So, what creates the stress? The stress comes from our thoughts, our worries, our fears. Really, stress can manifest, first of all, in the mind. Next source of stress is what we allow into our bodies. And the last workshop we talked about is foods that create inflammation and prevent healing. You got toxins from foods, toxins from ingredients, with toxins from when you smoke. You got toxins from the environment, such as volatile organic chemicals from paint or certain ingredients in our immediate living environment, sometimes from dry cleaning. You got toxins from medications and ingredients added to the medications. You even got toxins to the protective ingredients of certain drugs that we use, right? So you got other sources of toxins that enter into our body knowingly and unknowingly. But the most common one that we're going to be talking about for the essence of this workshop are the traumas that create the stress on your body. Traumas that come from how you fall down, all right? Big falls, small falls, or just big traumas like from sports, right? I'm going to show you another example. Think of football. Everybody loves football in this country. And trauma comes from every time that your head contacts the ball in football. If your spine is in a good position, not a problem. But if your spine is in a bad position, unhealthy position, and either you as an adult or as a child, think back to many, many years ago, you're heading the ball, you're creating repeated trauma to the top of the head that creates stress on the joints, stress on the position, all right, alter the position, and starts to prematurely damage the discs and damage the tissues that makes your spine from a protective structure around your nerves to a damaging structure. So those are the type of traumas they can think about. You also have big traumas that people don't really think about, such as how they fall off the motorbike. There's so many times in our clinics when you do a health history and we ask, hey, do you ever have any falls or spills? And I have somebody who just say, well, yeah, I fell off a motorbike when I was 8 years of age or 10, but I got up, I was fine, right? I didn't need the hospital. I'm like, whoa, hold on a second. Oh, that is significantly serious because it only takes 10 kilometers an hour of impact, right? Vehicle impact to create a whiplash effect that damages tissue that creates long-term changes to the spine. So if you've ever had a car accident in the past and we don't know about it, or your doctor doesn't know about it, chances are that this is something that might be interrupting you, causing you disruption in your neck and other parts of the spine. So you got big trauma such as that, trauma such as how you fall down, slip down the stairs, how many times that we've fallen in the shower or falling out on a wet floor when we were cleaning our floors at home, or even outside on the stairs when we were trying to ascend the stairs of the MRT. Those are the most common traumas as well. The most common one all comes down to what we use on a constant basis. The phones, folks, the phones, adults and kids follow our habits. We've got the trauma from the amount of time that we spend in front of the computer because the job calls for it. We also have the trauma, the low micro trauma that comes from the amount of time that we're spending looking at our phones, looking down, or gaming, right? Men and women, doesn't matter. Gaming, this is the most common gaming position that I see many people on training in. And we'll talk about a suggestion as to what you can do to offset that trauma. Plain and simple as this. If you're going to use your phone on the train or anywhere, support your elbow should be shoulder height. That's the best way to minimize the micro trauma on the neck from our technology. So make the change. Use your phone differently. So the micro trauma, right? And this looks familiar to anybody? I'm sure it does. Either you've seen many people around you like this, or you have family members in which this is their common posture. You don't even know what they look like. All you recognize is the top of their head and whether or not they're graying or not. The fact is that this is way too common. If I'm on the train MRT, this is what I see. And as long as this is happening, we as chiropractors are going to be in business for a long time. So we want to educate everybody, as many people as much as possible, about how detrimental this is to overall health and well-being, starting with the kids and then carrying over to the adults. So your head, depending on the position of it, right, increase the amount of weight or strain on your spinal cord. So think of it this way. If you were to hold an object that's not really that heavy, let's say this object is Okay, the spine, model spine is around the weight of your head. Okay, if I'm holding this object close to me on my center of gravity, you can hold it for a long time. But the further that object is held away from the center line or center of mass, that's the more weight, or that's the more effort that your muscles have to do to counteract that negative weight. So if you're holding it here versus holding it here, you know you can hold it much longer here than here. So regarding your head and your neck and your neck posture, the moment that your body's carrying position is actually ends up pulling forward, where your ears come ahead of your shoulders and your shoulders come ahead of your hips, then you're exponentially increasing the tension, pressure on the discs, which puts you at risk of herniation, and you're also exponentially increasing the tension, the pulling on your spinal cord. Okay, so it's doing two things: compressing your discs, making it wear down faster, and you're pulling, like you're tethering two ends of the spinal cord, because now you're increasing the distance between the top of your skull and the bottom of your tailbone. And now, instead of the cord being nice and fat, you're making it narrow over time with the head coming forward. So perfect example would be if you're driving on the PIE, or the expressway, or TPE, and it's 6 lanes wide. Okay, fast traffic back and forth. Now imagine that you eliminate the last outer 2 lanes and you have the same amount of traffic on that road. What are you going to expect to happen? Traffic jam is going to slow down. Are people going to get to their destination? Absolutely, but it's going to slow down. Now, then you narrow it down some more, take another 2 lanes. Now you start to have congestion, right? Things aren't going to be working properly. The city's going to come to a standstill, all right, ultimately. So that's what happens in your nervous system. The signals that are trying to get from your brain down through your spine, down through your neck to the rest of the body, end up going through congestion, because when you lose your neck, you're narrowing down the canal, narrowing down the road for the nerves to travel. So our job is to make sure that and teach you what's going to take to keep that road as wide as possible, so you don't have congestion. And that congestion shows up as different stresses on your nervous system, not just with pain. Okay. So when you have this congestion and it doesn't get checked, you create a condition that we call subluxation. Subluxation. Okay, your joints can misalign either individually or over a group or region. Then if you live and do your day-to-day activities over a long period of time, then it creates soft tissue damage. When you damage tissue, your body recognizes it as, okay, this is not supposed to happen, or we want to try to protect it. So the healing response immediately is inflammation. And inflammation is good in the right way to prompt healing, but also inflammation as the warning signal to let you know that, oh my goodness, let's stop whatever activity that's happening so that you don't do any more damage. Hence the nerve irritation that's around the area when that's being either inflamed, either because of the disc or the nerves being irritated. Now, as response to the irritation, your body starts to create a protective response. Like the muscles around that joint starts to seize up to try to minimize movement, because it's trying to, once again, protect itself. So this is all a protective response. So that's where you have that muscle spasm. So when we're touching your neck or mid back, lower back, and you start to feel like ouch, ooh, ow, or even you can touch it yourself and it feels tender to the touch, your spasm is the only response to the irritation or inflammation that's happened to the damage at the joint level. And then when it gets locked, then you don't have exchange of fluids coming in and out. You don't have imbibition. Okay. And when you don't have imbibition, I got to show you on the model. Well, we talk about this in the lower back. We're going to talk about this in the neck. Movement is crucial. Movement is key. You're supposed to turn left, right, bend forward, back and forth. And the movement draws fluid into the discs, keeps it hydrated. Okay. But also the movement of your spine, movement of the joint, helps irrigate around the nerve, so you don't have a buildup of ingredients and peptides and debris that creates inflammation. It helps remove the waste material from damaged tissue away from that area. But if you don't have movement, let's say if you have spasm and you're always locked and you have joint fixation, then you're creating an area of like a static pond. Like it's a lot healthier to drink from moving water than static water. Dengue and disease doesn't thrive in moving water. It thrives in still water. The same thing that happens in your spine. Any parts of your spine that doesn't have motion, that actually is loses joint imbibition or the ability for water to get in and out of the joint. Okay, then it creates this kind of like this pond-like effect, creates inflammation, right, and leads to further irritation of the nervous system, kind of like a vicious cycle. And it starts to fixate the joint, and the joint forgets how to move totally at all. And so, when that happens over a long period of time, that's why some people have a. It's very difficult for some people to see changes in their neck and their posture than other people who have less long-term inflammation and damage. Is everybody with me so far? Okay. So all this, everything that I'm talking about, creates a stress state in your body. Okay. Now this is a silent irritation to your structure of your body, and it doesn't necessarily always reflect as pain. Okay. Nerve irritation is not always a sharp pain. Nerve irritation can create a reflex response, okay, a low subtle reflex response that leads to joint fixation, but constant elevated stress from subluxation will create other bigger issues that goes beyond your spine, beyond the spine, extends into the organs and causes this. Increases the blood pressure, increases your heart rate, changing in your muscle tone, causes it to tighten up. It alters your digestive system. So if you're not having regular bowel movements, sometimes it can be traced to subluxation. If you have acid reflux or trouble digesting food without feeling gas or response, sometimes it can be related to subluxation because you have an abnormal stress response that's constantly elevated. Reproductive problems can be related to abnormal stress. Serotonin that affects your sleep and wake cycles and ability to maintain peace can be altered from high stress. How you perceive your environment can alter your sensory systems, make things that normally would not be painful feel more painful, right? Or fear and anxiety, which is actually an emotional state, can be altered because of chronic stress to your spine. Your the organ that eliminates the insulin, the pancreas, can actually alter its function, which also changes the insulin sensitivity. That can be altered because of stress as well too. Okay, blood sugar, which causes blood sugar to go up, and then when you have high blood sugar, then it creates a cascade of a cholesterol elevating response that most people are medicated for. Right, clotting factors, and when you have high sugar and this chronic stress state, you also have a suppressed immune response. You guys got that? When you're in constant stress state, your immune system is suppressed. Nowadays, at this time and place, when we have this COVID that's going around, can anybody afford to live with a suppressed immune system? No. No one can afford to live with a suppressed natural immune system. Even before they actually even make a vaccine, what is keeping all of us alive and keeping us fighting the viruses, not just with COVID, but other diseases, other viruses that enter the body, is our immune system. But as long as you're under stress, that becomes weak. So if you have always chronically getting sick all the time, seasonal allergies, you always get the sniffles, it may not be that you're destined to be sick all the time. You just might be under constant stress and not know it. And that stress might be coming from the spine. So when we look for subluxation, we know that we're looking for joint misalignment, tissue damage to your nerves, soft tissue damage, inflammation, irritation to the nerves can sometimes feel like pain, other times it may not feel like pain. Okay, muscle spasm, loss of flow into the joint, fluid in the joint, bone degeneration that we call arthritis, and joint fixation, which alters your gait and motion. Now, the very, very first sign, I'm going to show you guys, the very first indicator of possibility that you might have a subluxation is your posture. Okay, normal, you should have your shoulders level, ear should be straight. So when we're looking at you, if you're looking at pictures and you notice that there's a tilt like this, right? And we say stand up straight, and you're saying I am standing up straight. That could be indicated that you have some type of subluxation. Okay, or if you look at your posture and you go stand up straight, okay, and you say I am standing up straight. We take the picture, look at yourself. These are possible indicators that you have ongoing subluxation that you don't even know about. Okay, so that's the very first sign that we used to use to indicate do you have subluxation or not. Well, let's look at your posture. Next is how you're moving. Do you have that full range of motion inside the neck, side to side, front and back, round and round? Do you have it in 3 planes of motion without restriction, without pain at the end, without irritation? Okay, so these are the other indicators, your range of motion. If you have any troubles with how you bend, turn, or flex backwards, or even if you hear those noises like those are signs that you might have an ongoing misalignment that hasn't been checked, right? That relates to subluxation or nerve interference. And then the last indicator, the most common indicator, or what people tend to recognize, is neck stiffness, neck pain. Pain is the last warning sign that you might have a subluxation. So once again, what percentage of your nerves carry pain signals? 10% or less. Okay, only 10% of your nervous system carries the signals for pain. We're concerned about the other 90% that don't carry pain, that control everything else inside your body. And we hopefully that you become equally as concerned about it as well. Okay, so I love this image because it simplifies everything we just talked about. If you look to the image on the right, that's how our fuse boxes look like in the US. They're vertical. In Singapore, I've seen some fuse boxes more linear, more horizontal. But the point is this. Think of your spine as a series of switches. I'm going to use this model for a second. So think of your spine as a series of switches. Electricity is flowing through the switch, okay? When you're damaged, if you have any type of damage to your spine or you injure yourself or any type of irritation to the joint or any type of stress on the nerve, your body goes into a reflex response like a proper electrical switch, and it shuts off like a breaker panel switch. Okay, shuts off to protect it from more damage. So the locking up is a protection of your body. That's what it's designed to do. What's not designed to do is to stay unlocked forever. And so that's our job, is to find out what levels of your spine that have that breaker switch been shut off, and then reopen that switch, reset it. Okay, plain and simple as that. Okay, your body, the way that your body works, the signals work, your arms and hands, everything that works, it's all signals, communication, and energy. We're not concerned about pain. We're concerned about how your body's able to communicate and heal, because healing comes from the signals coming from the brain that tells your body to heal and repair. So if there's a blockage here, we want to reset it, okay? Reset that switch so that the connection works better, plain and simple. Some people lose those connections much more frequently than others, and that comes from our lifestyle, our habits, our stresses. So what creates that trip, the surge trip that you see inside an electrical panel, which we call our spines? So trauma, thought, and toxins can disrupt those signals and create the disruption of that nerve supply, we call subluxation. Trauma, thought, and toxins. So we talked about this before. When you do have the joint misalignment, soft tissue damage, they can lead to problems that go further down your arm, further down your extremity. That goes into shoulders, arms, and elbow dysfunction, wrist and carpal tunnel syndromes, hand problems. So before you get any type of surgery done, any type of medical procedure done to the extremity, is anybody asking, are the connections closer to the spine open? Before you treat the symptom at the extremity, check the closer end next to the neck first. Okay, you can experience a lot of headache and migraines, and a lot of headache and issues by looking at the root issue, not just the symptom. Okay, and visibly, what subluxation looks like is it could look and feel like an irritation on your nervous system, interference on the nervous system. So subluxation causes nerve irritation and interference in your body's ability to heal itself and remain healthy. Your body's continuously healing, but it needs a clear pathway for that to happen. Any type of blockage or slowing down of the electrical signals of that connection through your spine or in the openings of your spine will disrupt your body's ability to heal itself. Okay, so C1 to C7, T1 to T5. Sometimes the source of your neck pain does not come from the neck. Sometimes the source of the neck pain comes from the upper part of your back. So I need the spine to illustrate this. So, hey doc, I got a pain right here. Why are you treating my upper back? My pain's not here. Well, we are adjusting your upper back because if you have a kyphosis, if you have a hunchback, and let's say you have a flexible neck, flexible spine up here, all right, and it bends. Now, sometimes you might have a curve, but if you have a hunchback all the way down here, then no matter how flexible that you are, until you're able to create that natural extension, then you're not going to be able to bring your head in line with the center of mass. You guys got that? So sometimes the underlying cause of the problem of the chronic neck pain is not necessarily come from the neck. We have to look and treat and adjust this area of your spine, the lower area of your spine, so that the top area of your spine can actually pull back easier. Okay, so people who walk around that have naturally this posture, either they might be flexible, but this part of your upper back needs to be brought back and the shoulders coming back. Okay, so that's a part that's often weakened because of our work posture. So to address the neck, we look at C1 to C7 for those subluxations, but we also look to T1 and T5, those levels, to help the neck as well too. All right, guys, with me so far still? Awesome. Awesome, awesome. All right. Vanessa, how are we doing with time? Yep, 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 good. All right. All right, so we're just about wrapping up, folks. So text neck can lead to degeneration, scar tissue, and permanent changes that looks like this. All right, so the arrow is pointing to extra bone being formed, because if you're constantly bringing your head forward, your body's response is to create more bone, right? Lay down more bone, which is immediately is a good thing for stability, but it's bad for mobility, which leads to imbibition, which leads to joint fixation, and which creates that chronic state of pain and immobility. So what you want to avoid as much as possible is seeing any type of bone where there should be fluid, okay, where there should be an open space. So that's what the arthritis looks like as it forms. If you have a lifestyle, if your head coming forward, looking down, either at a screen, computer monitor, or laptop for most of your life. Okay. So the problems, as I said again, neck problem shows up as, or the signal shows up as neck pain, stiffness, loss of range of motion, degeneration, arthritis, the popping and cracking sounds, and sometimes upper extremity issues and headaches and neck pain. So what do? What are habits that you can add in? What are habits you can break? Well, the most common bad habit we talk about is how we use our phone, right? Once again, the phone should be shoulder height or above, okay? Or increase the size of the screen so you don't have to bring it so close when you're reading it, when you're watching it. Increase the size of the font. So posturally, I can break bad habits of how we set up a workstation at work or when we're working from home, adding specific exercises and chiropractic adjustments. In fact, right now, I'm going to show you one of the specific exercises that's going to help you, and you can do it any place, at any time, specifically, even at work. YWLT. Okay, this is fun. I'm going to take you through this. And hopefully you guys can try this along. Okay, so I'm going to try and move this back so you guys can see more of what everything looks like. There we go. Okay, so YWLT. So the Y. So this is best done standing up, but I'm doing it sitting down just because of where the camera's set, right? So Y involves your hands forward, your thumbs facing backwards, and it's like you're raising your hands straight up, making that Y. Like a rugby referee, go post, let's goal. It's good. So what you're doing this, Y. Okay, now in this position, you can roll your shoulders back. Okay, not up here, but back. So you're raising your hands up, shoulders back. Y position. And you're going to hold this for 3 breaths. It's harder than it looks. So that's a Y position. Okay, then the W position here is keeping that shoulders back, and W position, shoulders forward, and you squeeze your shoulders back and you bring your elbows in this position. So your hands straight. Hands straight. And you're squeezing your shoulders back. We don't just want to bring it straight like this, but squeeze the shoulders back. Now that's the Y position. That's the W position. I don't know my letters. Next letter is a T. Extend it out. And you're squeezing your shoulders back. So in all these motions and movements, we're squeezing our shoulder blades back together. Not sticking the head forward like this, but we're squeezing our shoulders back together. And you do that for 3 breaths as well. Excuse me. Oops. 3 breaths. And the last one here is the L. So keeping your shoulders back, you're bringing the elbows to the sides to create an L. So you're not bringing it up, but keep your shoulders down. So drop your shoulders down and the elbows come to the sides. And you hold this for 3 breaths. Pretty easy. Okay, so 3 positions. 1, 2, 1, 1. That's Y. W, W, T, and then L. Okay, YWTL. Okay, I'm not going to ask you how to spell it. There you go, Vanessa. YWTL. So those are exercises that should be done regularly. I mean, at least every hour or every 2 hours, because what's happening is that every single day, how many hours at a time are you doing the opposite? These are overbalanced. These are actually too shortened, too strained, too tight, and these behind are weak. Specifically, those muscles between the shoulder blades. So that is an exercise that you can constantly do. Anybody and everybody should be doing this. Students, people who work from home, people who find themselves working constantly with their hands in front of them. If your hands are in front of you for your job, you need to be doing this. If your hands are constantly in front of you for your job, you need to be doing this. Got that? If your hands are not in front of you for your job, you don't need to be doing this. But or if your head is constantly forward, should be a daily routine, and it's very simple, very duplicatable. Okay. Hey, thanks, Eric. Is that Erie? Thanks. Hopefully, you get to use that as well too. All right, we're just wrapping up here, folks. You guys doing great. Great. So, how do we find subluxations? Well, we use some instrumentation. Sometimes you do thermography. We check to see the muscle activity of the spine. I think we've done that in our clinic. We used to do the corporate talks at your workplace. We check how your joints are moving. I said before, we motion feel the joints to see, are they turning, are they moving, are they bending. We use static palpation. We use visualization of looking at your posture. We take those posture pics. Now, most importantly, we use X-rays to determine the underlying issues that leads up to the issue that you have. So X-rays tells a story. It tells a history the same way that the rings of a tree tells a history of a tree. So the X-rays are an important tool for structure and postural correction. We're not just adjusting to feel good, but we're also adjusting to make sure that we can help you make some long-term changes over time. So the way that we use X-rays is the same way that a dentist uses X-rays. So if you go to the dentist and you haven't seen them for 10, 15 years, and you show up and go, all right, I just want to get my teeth checked, they're going to find problems. And they're not only going to look above the gum line, right, with the scope and with the mirror and scrape it along. They're also going to take pictures below the gum line and X-rays below the gum line, because they can tell the history of the story, or they can tell exactly what trajectory the health of your teeth are going based on the depth and the density of the bones and of the roots of your teeth. We're like dentists for the spine. We're looking for the exact same thing. We're looking to see, okay, yes, you have the problem. Yes, you have this body signal, but let's see the underlying issues that led up to the body signal in the first place. Let's see what was the story that led up to that, because it can give us a lot of clues and can give you the clue as to what needs to change to rewrite how you live your life, how you manage your body, how you promote healing. Because we're not just going to be focused on pain. We're going to be focused on the structure and improving the function of that connection. And we have to look at the spine. All right. Guys, doing great so far. Any questions? Everybody still awake this Friday? Good. So if you have any questions, just ask. And if you're on this, you haven't been checked, please schedule a time and an opportunity to get your own consultation done, to get your own spine checked. I'm assuming that most people on this call, most people in this talk are patients or clients of one of the clinics in Tampines or the CBD or Topayo. But if you're listening to this and watching this and you know that, wow, it's helping you, but this is information that needs to benefit someone else that you care about at home or a coworker, and they don't know about this, you don't have to hold this information yourself. You got to share that information, because you can actually literally save their life. They might be suffering, they might be miserable, they may not say it, but people silently suffer and live miserable lives, suffering and constant stress, not knowing that their stress might be related to the spine. So give and share the gift of health, all right? And we want to give you an opportunity through this scan code. And this scan code is for anybody that you care about to scan this and get an opportunity for a free consultation and visit one of our clinics, okay? So we're gonna leave this for a couple of seconds right now. For anybody that to arrange an appointment, or at least just to give this gift to somebody that you care about. who should know this information that you know right now. It might be a family member, it might be a coworker, it might be an aunt, uncle, grandmother, grandfather, whoever it is. We or any one of the docs will sit down and just listen, have a consultation, listen to their needs, listen to what concerns them, but more importantly, get to the root issue that's interfering with the quality of life. All right. So that is it. So I'm going to look at the chat box, and is everybody still alive here? Everybody still on point? Just give me a thumbs up. No, everybody's acting shy. That's okay. No, this has been a great experience teaching these body signals workshops. It's what I believe adds value to your care. Adjustments is one thing, but the knowledge to change your life is even more powerful. We don't just want your spines, folks. We want your minds. We and all the doctors here and the team at Total Health Chiropractic not just want your spines. We want your minds. We want you to be engaged in these workshops. Even when I leave, this is going to continue in other formats with other doctors teaching these seminars, these settings here. If it's going to be either online webinar or actually when COVID passes and it lifts, we're going to start having it in our offices again. So please participate, not just for our edification, but for you guys as well. The more knowledge, the better, the more empowered you're going to be. And actually, guess what? Singapore's going to look like the healthiest nation in the world. But don't just take it as information. Start applying it. Apply it for yourself and help others that you care about apply this knowledge too. And introduce them to chiropractic, introduce them to Total Health Chiropractic, and let them know the good news that they can be helped. Okay. So folks, my name is Dr. Max, and this is my last body signal, my last workshop in Singapore, my last opportunity as a chiropractor before I go back and be a stay-at-home dad with my girls. So it's been an honor and privilege to be given this responsibility, be trusted with this by Dr. Tim and Dr. Vanessa and the team, my teammates I work with at Total Health. So I'm grateful. I'm grateful for your attention, to be, your attention as well too, as patients and clients, to be able to watch and listen to this. I appreciate the feedback, and more importantly here, I pass the torch. You guys are going to become health warriors, chiropractic warriors with more knowledge like this. So stay on board, tell others about chiropractic. What they don't know can hurt them. Save the life, spread the word, and let's get everybody checked in Singapore. Mwah. Peace. Take care, folks. DC, Dr. Maxwell, or the Naked Doctor. Look for the Naked Doctor next couple of weeks, folks. And this Naked Doctor is out.